morning, sir. I'm Angelica Marasigan. I will show the head and neck assessment. Gather necessary supplies and equipment prior to the procedure. Prepare the patient by explaining the procedures. Perform procedures according to professional standard. Identify the needs of the client before and after the procedure. Make sure that materials are working. Good morning, ma'am. I'm Angelica Marasigan, your nurse for today. So, how are you?
I'm fine.
What is your name, ma'am?
I'm Chinyong Carable,
So, ma'am, how old are you?
25.
Did you feel any pain right now?
None.
I will do an assessment of head to neck. The purpose of this is to assess whether underlying issue or health problem. Ma'am, can you give me a time to prepare the equipment?
Oh, sure.
And I'm ready to assess the head and face of the client. The size and shape of the client's head is verifying of elasticity. The head is round in appearance, and I check for symmetry of the client's face. And ma'am, can you please frown, smile, and pop up your cheeks? So the head of the client, symmetry and appropriate of the body size, and now I will palpate the head. The head of the client is hard and smooth without any lesions, and now I will gonna palpate the temporal artery to check for any inflammations. So the temporal artery of the patient is elastic and not tender. And now I will palpate the temporal mandibular zone of the patient. And to do this, can you please open and close your mouth, ma'am? So that mouth closes and open fully and joints move laterally in one direction. Now I'm done assessing the head and the face. And now I will assessing the neck of the client. The neck of the client is symmetric with head centered and no banding masses. The next is I will check the movement of. Observe the thyroid and cricoid is moved upward symmetrically. And next is check the vertebrae of the client. In 7 vertebrae of the client is visible and palpable. Next is the range of the motion. Ma'am, can you please face to the right and to the left? Then look down and lift your head backward. And your ears touching your shoulder. And the other side. So I observe the neck movement of the client is smooth and controlled. Next, I will palpate the trachea, but I will find the jugular nodes and I have palpate the thyroid gland. Line marks position in middle line. And ma'am, can you please swallow? The glandular thyroid tissue is felt rising underneath my fingers and the lobes as well. The next, I will auscultate the thyroid gland. Upon auscultating, I didn't hear there are no brow widths, and now I will assessing the lymph nodes of the client. Auricular, post-auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical, post-cervical, and supraclavicular. Ma'am, did you feel any pain when I'm palpating?
No.
As the client reported, she didn't feel any pain when I'm palpating the lymph nodes. I will test the Vera vision of the eyes of the client. Ma'am, can you look this object that I'm holding? The client has normal peripheral vision.
No.
I will perform the corneal light reflex by shining a light on the bridge of the nose of the client. So, I observe the reflection of light of both eyes of the client at the same spot. So, I will check the eyelids and eyelashes of the client. So, I observe the upper lid is between the iris and the pupil. The lower lid is rested on the lower border, the iris and the pupil. The lower lids is rested on the lower border of the iris. And next, I will assess the ability of iris to close. Ma'am, can you please close your eyes? So, the iris are closeness completely and easily. I will assess the position of the eyelid in comparison with the eyeball. The lower lid is upward right, no inward, and upward turning. And the eyelashes is evenly distributed. And how I will observe the eyelid and see no redness, no swelling, and free condition. And how I will observe the position and alignment of eyeball to the socket, so the eyeball are symmetrically aligned with the socket. And I will inspect the bulbar conjunctiva ancillary. Ma'am, can you look to the left and to the right, up to the ceiling? So, the bulbar conjunctiva of the client is clear, moist, and smooth, and the sclera is white. And next, I will inspect the palpebral conjunctive of the client. Okay, okay. So, the palpebral conjunctive is clear and no swelling. I will palpate the lacrimal apparatus of the client. I palpate no drainage noted. I will inspect the corneal. So I can see the corneal is transparent, smooth, and no opacity. The pupillary light reflects and consensual of the pupil. So the response is construction. Next, I will assessing the nose of the client. Inspect and palpate the nose literary nose. So the nose of the client is symmetrically. The color of the nose is same of the color of the face. I will check the patency of the airflows of the nose. Feel. Okay. Ma'am, can you please cover the left nose? Breathe in and breathe out. Then cover the right. Breathe in and breathe out. So the client is able to sniff through each nostril and the other is included. And next, I will inspect the nose of the client by using the pen light. Ma'am, can you please lift your head backward? The intern nose of mucosa of the client is dark pink, moist and free of exudates. The nasal septum of the client is free of lesions. And impact free of ulcers and impact the underneath of the client is dark pink, moist and free of lesions. And I will assessing the sinuses of the client. First, I will palpate the frontal and maxilla sinuses. Ma'am, did you feel any pain?
No.
Upon palpating the frontal and maxilla sinuses of the patient, there is no tenderness, and I will percuss the frontal and maxillary sinuses of the patient. Ma'am, do you feel any pain?
No.
Upon percussing the frontal and maxillary sinuses of the patient, there is no tenderness.